Hi, everybody. I'm Michelle Edmonds with Idaho News 6. Thanks for joining us for Making the Grade. Post-election coverage, of course, but probably even more importantly, as we are seeing coronavirus cases surge in Idaho, it is time to talk about how that is affecting schools. So here to do that with me is Kevin Richert from Idaho Education News. Kevin, happy Tuesday morning to you.
Hi, Michelle. How are you doing?
Really good. I want to invite everybody who is joining us live via Facebook or Twitter or any one of our other social media platforms here at Idaho News 6 to enjoy comment and questions. As you can hear my dog barking, right? Because I'm at home, because coronavirus cases are on the rise, and at Idaho News 6, we're trying to stay as safe as possible. Our Scripps company asking us to do that. So, Kevin, let's start with where K-12 coronavirus cases are right now in our schools. And as I said, if you have students, if you are a staff member, we'd love to hear from you as well as we go live on Facebook. You did a piece that talked about an increase in cases basically across the board.
It's trending upward across the state. The Department of Health and Welfare has been putting out a weekly report on K-12 cases. And the numbers that the department released on Monday, another sharp increase. At least 326 cases in the K-12 system for the week that ended Friday. And as you can see, as we scroll down, where that is in comparison to the week before and the 4 weeks preceding, it's a sharp increase. And I want to emphasize that when we talk about 326 cases in the K-12 system, that's not a complete number, because Health and Welfare will not release figures for smaller schools with 50 students or fewer, because of student privacy concerns. So we don't even really know what's happening in the smallest schools around the state, especially in rural Idaho. And in some cases, the numbers the Health and Welfare releases are minimums. They say that we have at least X number of cases in one school for a given week. So for a variety of reasons, these numbers they're kind of a conservative estimate. But they do give you an indication of what's happening in the schools. And by that indication, this problem is getting worse in the K-12 system, not better.
A lot of people, Kevin, would argue, including medical professionals, that this is what is to be expected, though. This is kind of the jump that people thought would come, even across the board nationally with COVID-19, as you started to get into flu season, as kids are going back into schools. So is this a real shock?
It shouldn't be. I think as we expected case numbers to increase across the state in the fall, there were a variety of reasons that the health experts pointed towards. And one was the reopening of school, whether it's K-12 or higher education. There are other factors, of course, the cooler weather, people are inside more, they're in close contact more. So what we're seeing right now in the schools, it shouldn't be a surprise, but what it is a challenge for school districts and for charter administrators to figure out how to manage. And, we saw an example just in the past few days of how Boise is really struggling with managing this situation and also kind of managing the public backlash over the situation.
Of which there is some,
Yeah.
which, Kevin, let's talk a little bit, though, about the fact that what schools have been dealing with here and why they're trying to keep these numbers on their different dashboards, different school districts providing different dashboards with case numbers per se. One of the interesting points when you look at schools is that they have to balance the transmission level inside their schools and what's happening there with the transmission levels that are happening per county. So there's kind of a 20% mark that really stands out. Can you explain what that 20% mark is and the fact that a lot of schools are still underneath that percentage?
20 is kind of it's a magic number, if you will, in coronavirus transmission rates. And when we talk about 20, we're talking about 20 cases, active cases per 100,000 residents. And for the health districts, that 20 per 100,000 population threshold, that's the point when the health districts say that a county is in the red zone in terms of coronavirus transmission. And Ada County has been in that red zone for several weeks. And the transmission rates in the schools are exceeding that 20 per 100,000 as we're seeing in the community at large. What that means and how you respond to being in the red zone, well, that's the problem right now, is schools are trying to figure out how do you respond to it. Let's look at Ada County. Let's focus on Ada County, where transmission rates are well above that 20 per 100,000. What the health district has recommended is that the schools can maintain and continue a hybrid learning model, which is what you're seeing happening in Boise and what you're seeing happening in the West Ada School District, even as the case numbers are increasing. So the challenge is trying to keep schools open, even in that hybrid model, while you are definitely seeing a clear spike in the cases. And Boise's numbers indicate it, West Ada's numbers indicate it as well.
Let's take a look at a few of those dashboards. I know that Health and Welfare, the state agency, puts out its dashboard that you were talking about. And again, this is not a complete picture of what's happening, but I just want people out there to realize that these resources are at your fingertips. Like if you're a parent or you're a teacher and you want to know exactly what's happening in your school, this is where you want to go. And of course, idahoednews.org puts links to these resources as well. But this one, you can scroll down here from Health and Welfare and see exactly what school all across the state, what numbers they're reporting. One thing I want to ask you, Kevin, Jana is joining us online here, and she kind of has an interesting question. As we're scrolling through, you can see by week what cases were reported, and then the far right-hand column there is the cumulative. Jana's asking this. She says, why isn't data separated by school districts who have mandated masks versus school districts who don't, that they're all lumped together at this state level? Do you think that that's something that, I mean, masks, and we'll get into it a little bit here with what Twin Falls was looking at last night, what Utah has decided to do in the last day, but are we going to see that kind of data point for us?
It would be nice. I think you raise a really good point, Jana. I mean, and I hadn't thought about it in terms of segregating out by districts that have mask mandates as opposed to those who don't. I would settle at this point. I mean, this is a good tool. What Health and Welfare is doing, it has some value. It's giving us a first-time statewide look with all of the qualifications I talked about before. And if you're a parent, if you're a teacher, you can scroll down, you can look for your school, you can look for it in alphabetical order. So it's fairly intuitive that way. But I would love to see this broken out by school district, so that we could say what's happening in Coeur d'Alene as opposed to what's happening in Idaho Falls, as opposed to what's happening in Boise and West Ada. I mean, it would be a lot of work for anybody to kind of go through here and try to figure out by school district, what are we talking about here? Because you've got public schools, you've got charter schools, you've got private schools. I mean, there's a lot to sort out here. It would be great to have this thing also sorted out by school district, but you know, for starters here, we're at least getting some data school by school. It's at least searchable for parents, for staff, for patrons, so that they can see what's happening in their neighborhoods. It's better than where we were at a few weeks ago.
And we should mention that some school districts are doing their own deep dive when it comes to cases as well. Boise School District, West Ada. Let's bring up West Ada's there, because they have a pretty good looking dashboard. And this is where we were talking about the transmission levels, and you can see it as they're projecting it, cases per 100,000 there, that 20 per 100,000, or that 20% threshold that we were talking about, Kevin. There was a bit of an outbreak at Mountain View High School in the past week. There are about 150 students and staff being quarantined specifically at Mountain View High School. So those case numbers went up. What happens when you take a look at a dashboard like this and you're on the board of trustees? How do you manage that compared to the health department, who ultimately could send a school district into all virtual, because they do have that authority, sort of. So again, let's go back to that push and pull and that tug, and why these dashboards really have an important role to play.
Okay, so a couple things that I look at as I look at this dashboard, and you know, again, that transmission rate, and you can see at the high school level, it's quite a bit higher than you see it in the middle school and the elementary school. And there are a lot of reasons for that. I think that, you know, high school students are simply more mobile. I mean, they're in multiple classrooms, they're in hallways going from class to class. I mean, there's a lot of possibility for students to interact, and if there is a student who's positive, there's more potential for that student to pass on the virus to other students. And you look at the high school numbers. You mentioned Mountain View, but that's not the only high school in West Ada that's had some spikes in cases. I believe Eagle and Meridian as well. And if you scroll down, and you can see not just the case numbers in those high schools, but you can see the numbers of students who are in isolation right now, who are in quarantine. So for Mountain View, it's not just the 17 cases, the student and staff cases. It's 140 students who are at home, who are isolating. Meridian 135, Eagle 134. I mean, that's where you're seeing the impact on day-to-day learning, as well as students are being forced to quarantine to try to keep those case numbers from getting any higher.
And you can find dashboards like this on the Boise School District website as well. They have a different style of dashboard here, but we've been showing this off. Boise was one of the early adopters of putting these cases out there. One thing we should mention, though, that school districts face here, Kevin, and it's hard on them because they have to make sure that they're keeping everybody's anonymity, as well as they're providing health information to the public. And that's a difficult role for these districts to play.
Right. So what you've had happen with Boise and with West Ada and with the state database too is that they're not differentiating between student cases and staff cases, because it's a privacy issue, not just for the students. I mean, there's a privacy issue for the staff as well. I want to emphasize one thing as we scroll down, and we're right looking at it. The Boise spreadsheet right now is showing 76 new cases, positive cases, since November 3rd. That's a 1-week period. So between the confirmed cases that Boise's reporting right now and the probable cases, they've had more cases in the past week than they had in the preceding 2 weeks. And, that's just over a couple of days of face-to-face learning, a couple of days of hybrid learning, because November 3rd, Election Day, schools were closed, kids were home. You had virtual learning on Monday, because that's the Boise schedule is everybody's home on Monday, and then they're all alternating face-to-face Tuesday, Wednesday, Thursday, Friday. So you've only had a couple of days, 3 days of face-to-face learning since November 3rd, and you've got 76 new cases in the Boise schools, 76 confirmed cases, and I want to say it's about 18 now probable cases. That's above what the district saw in the 2 weeks preceding. So there's no way you can look at those numbers and say that the problem isn't intensifying in the Boise schools. The numbers make that very clear.
So Kevin, numbers are going up, whether it be adult transmission numbers or student transmission numbers. The number of cases of COVID-19 are soaring. Yesterday, Idaho hit its most cases ever in one day.
Yes.
We recorded 13 deaths in the state. When do school districts have to come up with a new plan?
Wow, that's the big question right now. Can schools continue what they're doing? Can they maintain what they're doing? Can they sustain it as these case numbers are increasing? And that's the big question right now facing schools. And I go back to Boise again, because last night the trustees heard from a couple of medical experts, a couple of doctors from the hospital systems, talking about the reopen and talking about the coronavirus. They're also hearing, though, from we received a letter from 3 school nurses saying, look, you can't tell what's happening right now in terms of the community spread. You can't calculate the school's role in spreading the coronavirus at this point. And there's so much disruption right now with the quarantines. There's so much disruption with the students who are staying home with cases who have tested positive. They're saying we're at a point where we need to go back to online learning. That's the only answer at this point. So you've got that debate going on right now, and school trustees and school administrators are right in the middle of it.
What's the threshold? Is there a threshold? When do people know when to pull the plug and send all the kids back home? Like, who's making those decisions?
The decisions are all being made locally, and I think they're all being made. That threshold is going to be different for every school district and for every charter school. That's a cop-out answer, but that's what we've got right now. That's what we set up when we decided we're going to leave this decision in the hands of local officials. You're going to have local decisions, and the decisions are going to widely vary. You know, what one school district decides is too much, another school district might say is manageable. You know, you're seeing it happen not just with the school districts and the decisions about staying open or hybrid learning or online learning. You're seeing the same kind of disparity and sometimes disconnect between communities as they talk about mask mandates. You know, it's all over the place, and you know, get used to it. This is what we've set up. We've, you know, if you adhere to the idea of local control, and Governor Brad Little has talked about local control over and over and over again through this pandemic. If you want local control, you're going to have all kinds of decisions, all kinds of thresholds, you know, all kinds of different sets of criteria being used to decide what to do. You know, this is what we set up, and this is what we're going to have. And as the pandemic continues, and you know, we see the numbers worsening, those local decisions are going to be, you know, even more closely scrutinized.
You're talking about local control. Let's talk a little bit about Twin Falls and what happened with the city council down in Twin Falls last night. They were looking at possibly having a mask mandate, and this comes on the heels of Twin Falls County reporting 103 new cases of COVID-19 yesterday alone, and reporting six deaths
Yes.
in the county with COVID-19 related illness. And the city council last night decided to put a hold on a mask mandate. Are you hearing anything from school districts in that county and what they want to see?
Not yet at this point, but you know, again, Twin Falls has been a hot spot in terms of coronavirus for quite some time. You know, one of the highest numbers of cases in the state, and that really goes back to the beginning of this pandemic. So I think the pressure point right now in Twin Falls is the tension between the health community and the city council. You had, the medical community saying we have a crisis right now. Our hospitals are full or getting very close to full, and it's not going to get better as more cases. We get more cases, we get more hospitalizations. So the hospital community is saying we need help. And we need something that eases the pressure on the healthcare system. So, the decision for Twin Falls to table this mask mandate comes at really a critical point in the outbreak in Twin Falls County.
Bernadette's joining us. She's saying that Governor Little should be more proactive, or should have been more proactive, if you want to read that correctly. Utah's governor has taken a very different approach starting yesterday, and it's something that he supported local control, if we're talking about that, all the way through this pandemic. But Utah has flipped. So talk a little bit about what's happened in Utah, and could it have any impact specifically on Idaho or on what happens in schools? Because there's a bit of a juxtaposition here, because Utah schools are still open.
Utah schools are still open. Let's talk first about the mask mandate. Utah Governor Gary Herbert, who had opposed a statewide mandate in the past, had been willing to leave this to local control. And I should point out that most large cities in Utah have had mask mandates in place. Well, he reversed course on Sunday night. He announced this on Sunday night. I was, scrolling around on my phone, and I saw an alert about this. I was like, wow, this is a fairly big development. So Sunday night, he said, we can't debate about masks any longer. We've got a problem. And what was the problem in Utah? Stop me if you've heard this before. Rising case numbers, rising hospitalizations, increased pressure on the healthcare system in Utah. Exactly the same scenario that we're seeing unfold here in Idaho. But the difference here is Governor Herbert said, we've got to have a mask mandate in place, and it's going to be in place for the foreseeable future. when I saw that Sunday night, first thing I wanted to do Monday morning was fire off an email to Governor Little's office and say, hey, what kind of reaction do you have to what's happening in Utah? And what does this mean anything in terms of Idaho's policy? And you have to remember, Governor Little, from the beginning, has talked about local control here, has talked about local mask ordinances, has resisted repeatedly the idea of a statewide mandate, and he's still pretty much there. I mean, he's saying, we value local control and the local approach to addressing important issues. He goes on to say that his spokeswoman says, the governor will continue to support those local leaders who make tough decisions to protect our at-risk citizens. Well, and I think that goes to the comment you just showed before. Some local leaders and some local jurisdictions are not making those decisions. As we saw with Twin Falls last night, as we saw with Post Falls up in the Panhandle, also on Monday, rejecting a mask mandate. So again, you've got this kind of patchwork effect. Ada County's had a mask mandate for quite some time. Other communities are not going with mask mandates. I mean, Ada County is not the only community that has one in Idaho. There are other communities that have gone and done something at the local level. But again, you have a patchwork, except when you talk about the outbreak itself. There we have pretty consistent increases pretty much all over the state. I mean, I crunch those numbers every week, and I'm telling you, we're seeing large increases in cases in rural counties, in suburban, urban counties, and all over the state. Outbreaks in Nez Perce County, in Latah County, continued case increases in Kootenai, Twin Falls, Eastern Idaho, and now Ada County and Canyon County are seeing some really significant and sobering increases in case numbers. I mean, we're seeing 350, 400 new cases a day, some days just in Ada County. That's a big increase.
One place that has had more of a consistent approach has been at the university level. And I know that you're crunching the numbers for campuses across Idaho every single week as well, Kevin, and posting those at idahoednews.org. And this last week definitely had mixed results. And I want to talk a little bit about Boise State in particular, because the number of coronavirus cases was associated with Boise State is definitely up, but so is testing. So explain that to us.
And that's exactly how I couched it in my story, because when I looked at Boise State's numbers on Friday, when Boise State posted its new case numbers, it's a big jump. Case numbers more than doubled over the course of the past week, after those numbers have been dropping off for several weeks. So you see this doubling of cases and you're like, well, what's going on here? And you scroll down further on their website, and they have a really slick website. They have a lot of information on their dashboard. You scroll down, you find out that the testing also doubled over the course of that past week. So this is that age-old debate that we've been having throughout the pandemic about the correlation between increased case numbers and increased testing. And folks who have tried to downplay the nature of the pandemic and the nature of the outbreak, starting with the president of the United States, have said over and over, we have more cases in America because we test more in America. Well, that's not really the case. That's a lie. And it's not even accurate when you look at what's happening statewide. But it is accurate in this one microcosm, in this one example here at Boise State University. You can say with some confidence that the case numbers that Boise State reported last week do correlate at least, with an increase in testing. So if you double the number of tests and you see a doubling in the cases, well, that at least tracks. That at least tells you that the positivity rates, the percentage of tests that are coming back positive, that's not changing all that much. And it tells you that, maybe you're not in the middle of an outbreak where you really have a spike in cases and a spike in infection rates. What you have is a spike in cases as a result of a spike in tests. And, what have we been saying over and over since the spring? The more testing, the more data you get off of testing, the better off you're going to be, because it gives you a better sense of who's infected, who may have infected other people. You can do contact tracing more effectively when you know who's sick already. This increase in testing at Boise State, that's not a bad thing. That's a good thing. The more testing data you get, the better. And you look at what's happened at University of Idaho over the past several weeks, where they've seen their case numbers drop significantly after some alarming numbers earlier in the semester. U of I took a step back, did a lot of testing, basically tested the entire student body in Moscow. And now they've got case numbers that are really, really low. I mean, they only hit 7 cases for the 7-day period ending early last week. So, the more you test and the more research you get and the more information you get from tests, the better you can address outbreaks. And we've seen that unfold to a large degree at the University of Idaho. Now we'll see how it unfolds at Boise State, now that they have a little bit more data and have a better handle on some positive cases. What happens from here? We'll be watching it very closely.
Kevin, another topic I want to pick your brain on is something that we have addressed here on Making the Grade back when it was first announced at the beginning of October, which is that the federal government was going to provide states with rapid COVID testing, and states would be allowed to choose how they were going to use these rapid tests. Governor Little, during one of his press conferences, talked about how he wanted to implement rapid COVID testing for students in particular, to give them to the school districts or the health departments to test students so that we can keep schools open. That was, about 6 weeks ago? Where do we stand on these rapid COVID tests? Have they been distributed? Are they being used effectively? What do we know? It's
starting to unfold, but it's varying from community to community. It's varying from health district to health district. So again, quick civics lesson. Again, we got these 7 health districts that are playing a very prominent role in Idaho's response to the coronavirus. And these health districts are having a very prominent role in figuring out how to roll out these rapid antigen tests. So it really is varying from community to community. Again, we're going to watch and see what we get over the next several weeks and a couple of months to see if the testing really did unfold as promised. Did we really get the ability to do, talking about 500,000 tests in the span of a couple of months? So, something we're definitely going to be watching closely. And I would urge you, if you're watching this, if you're a teacher and you're a staffer and you're wondering what's going on, or if you have some experience with this firsthand from your school, we'd love to hear from you.
Emily brings up a point, and I want to have her talk a little bit here. How much longer are we going to cancel our lives? Totally get that that's how that can feel. We are so afraid to get sick, we forget to live. Depression in our kids is real. And however you feel about COVID-19, there is, and I get where Emily's coming from here, a mental health aspect, Kevin, that we have talked about since back in March, when schools were literally canceled for a while there until they figured out what to do, that there is a mental health aspect to this, especially when it comes to students, that people need to be talking about. And I agree that Emily has a point there, that this is rough. It's rough as a parent. It's rough as a teacher and administrator. It is certainly rough if you have kids who are desperately trying to deal with all this.
Nobody's arguing that. Nobody's arguing that this is having a profound effect on mental health, especially for kids, especially for our most vulnerable Idahoans who really need the structure of being in school. Nobody's arguing about that. What we are arguing about, and what we are debating about, and what we're trying to figure out in the middle of a novel pandemic here, is how do you balance the reopen? How do you balance those mental health considerations against the physical health considerations of a virus that has now killed 700 Idahoans? That death rate continues to climb. And unfortunately and tragically, that death rate is going to continue to climb as we get more cases. We've seen that over and over since March. How do you balance opening schools, keeping schools open, with the potential that is going to lead to spread in the communities, and that is going to lead to more cases, more hospitalizations, more pressure on the healthcare system, and tragically, possibly more deaths. That's the balance. And nobody has a good answer for it. And, got nothing but sympathy for everybody who's wrestling with this, whether it's the health officials who are trying to figure out the balance, the school officials who are trying to figure out the balance, or the parents who are trying to figure out how to navigate this at home. This isn't easy on anybody, but you didn't need me to tell you that. We all know that this is hard on everybody.
Well, and we should mention too, Kevin, that they have to balance the fact that those deaths are not coming specifically in large numbers, obviously, in the younger populations as well. So how do you balance keeping schools open in some way, shape, or form, keeping the mental health of students okay, and yet knowing that they aren't the ones who are truly suffering the worst of the consequences, and balancing out how this can be transmitted in our communities. It is just a difficult combination, no matter what.
Right. And as you say, what we're seeing in Idaho is what we've seen nationally, what we've seen globally with the pandemic. For young people, this just not seems, it just is not as, the death rates are much, much lower for young people. And I don't have Idaho's numbers right in front of me. I don't think we've had any fatalities among kids in Idaho. Those 700 deaths I'm talking about, the majority of them are in older populations, older demographics, like we've seen nationally, like we've seen globally, but it's 700 deaths in just the span of a few months. And the concern about schools and school opening is kids may pass on the virus. They may not even know they have it. They may be asymptomatic. They may pass it on to a family member. They may pass it on to a teacher, and you may have community spread, starting with kids. And really, it may start with kids who are not showing any symptoms, parents who don't know if their kids are positive because they haven't been tested and they haven't shown any symptoms. That's the scenario that health officials are concerned about. And that's a concern that you have with school opening.
Well, let's end on a little bit of a light note, because we don't have the answers. We're just reporting facts so that everybody out there can make the best decisions possible for them. I want to bring in a comment here because it was a little bit funny. So Julie, I appreciated this. We're talking about how difficult all this is. She says that I let my teen drive, and then she came back and repeated that that's pretty scary too, which, Julie, just so you know, I've got one of those who just started in my house. So I'm with you on that one.
I taught 2 teenage sons how to drive, and you can see what it's done. Totally different drivers, by the way. And they're both good drivers right now. They came out the other side as good drivers. So hang in there. They do learn, they do pick it up. But yes, you never feel as out of control as you are when you're a passenger, when your teenage son or daughter is learning to drive and learning mistake by mistake. And so I hear you.
I say yes.
Good luck.
So we always love to end our Making the Grade segments because we like to have a little bit of levity and a little bit of fun. And I miss Kevin. I miss seeing my friend in person and not being able to report from the studio and do what we want to do, because we're trying to limit the spread, obviously, as well. So we have Kevin's show and tell, kind of our second grade mentality here on Making the Grade, where I get to learn something about Kevin's life that maybe I didn't know. So Kevin, what's up for
the part
today?
where we didn't outgrow grade school. So, and I think this is appropriate because if I look out my window, look out my office window, I got to squint a little bit, but I can actually see that it is snowing again. And I like snow. I love the seasons. I'm down with the seasons. This is the time of year where I do want to see some snow as we get into the holiday season. I want something normal, it's something that feels like we're heading into Thanksgiving and Christmas. But, still, even so, it's all about balance, right? So we got some palm trees going on here.
Palm trees on your socks?
Palm trees. And the pink palm trees even match my tie. I mean, it all falls into place sometimes.
All I know is that my daughter woke up and started listening to Christmas music, and I thought, you know what? It is not too early for Christmas music this year. That was my takeaway of the day. So palm trees on socks when it's snowing outside, I am all in.
And I'm not going to judge people listening to Christmas music early. I'm usually one of these purists who's like, I don't want to hear that stuff until the day after Thanksgiving. And that's probably where I'll still be. But it has been such a long 2020. If people want to, fast forward to Christmas season, and if it makes people happy, do what it takes to feel better mentally, because it's been a rough year for everybody. And
I agree with that. Well, thank you for your no judgment on my Christmas music in the house. I
Well,
appreciate
knock
that.
yourself
And
out.
I will pass no judgment on your palm tree socks on a snowy Tuesday.
Fair
Kevin, thank you and the gang for being so willing to share all of the information at idahoednews.org. If you want to look at some of those dashboards up closely that we showed you in the beginning, there are links there. There are a number of stories. We didn't even get to major topics like last night. The Boise School District appointed a new trustee after one of its trustees decided to leave kind of in the midst of all of the pandemic situation. So
And
if
out
you
of
want to read about
frustration
that
over
story,
the whole coronavirus issue. So yes, a new Boise trustee. You can read about her on our website and catch up on
lots of great stories.
non-coronavirus education news still going on. So there's a lot that we have to offer.
Thank you and the gang to idahoednews.org. That's where you can go. You can also download their app. Kevin, we appreciate you being here for Making the Grade.
Thank you.